Today I will be demonstrating a forearm elbow exam. So first we're going to start with some palpations. So I'll first start with some of the bony structures of the forearm and the elbow. So up top in the upper arm you have your humerus right along here, just your humeral shaft. And then you're going to have your biceps right here, so you can just palpate along there. Down to the cubital fossa, where you can feel the bicep tendon right in there in the middle. You can turn it up. And then to continue with bony anatomy, we're going to go over to the medial side right here, and we're going to palpate the ulnar head, which is going to be right below the medial epicondyle, so right along here, and then the medial epicondyle, which will be a little bit more prominent right here. And then you'll come down through the humeral or the ulnar shaft all the way down until you get to the ulnar styloid process at the wrist. And then we can come back up, and on the lateral side you'll have your lateral epicondyle right here, and then right below that you'll have your radial head, and then you can palpate all the way down to the radial shaft, connecting to the wrist right at the radial styloid process. Then in the posterior aspect of the arm, you'll get your...
I don't know which way to go. Probably this way.
There we go. You can get your olecranon process right here, and then just superior to it, you're going to have your olecranon fossa, which is just going to be a little divot in the back right there. So then that's about it for bony structures. Next we'll go to some soft tissue. So like I said before, you have your bicep cubital fossa, and then you're going to have your brachioradialis, which is going to be the most lateral wrist flexor. So if you can have your patient resist wrist flexion, so I'll put them in supination, and then resist that, and you can feel it on the lateral side. Then we're going to have your brachialis, which is going to be right along here around the wrist. It's just going to be like a band right there. Then if I can have my patient flex their wrist, and you can see the flexor tendons right here. So you have your palmaris longus, and then you have your flexor carpi ulnaris is going to be on this side, and your flexor carpi radialis is going to be right on this side. Then you have your supinator muscle, which is going to be right here, so I can have my patient go from pronation to supination, and you can feel that muscle right along there. Next, we're also going to have your tricep, which is going to be on the back of the posterior aspect of the arm. Then you'll have all of your wrist flexors, which are going to be on the connect to the medial malleolus, epicondyle. And those will run down and be your wrist flexors. So again, you can have the patient resist wrist flexion and just kind of feel all down there. And then on the lateral side, connecting to the lateral epicondyle, you will have all of your wrist extensors. So if you have your patient resist wrist extension, and you can feel all of those prominently on the forearm. That's about it for palpations. Next, we'll go into some range of motion. So I'll have my patient just do some active range of motion. So I'll ask him to go into elbow flexion, bring your elbow up. Good. And then extension, bringing it all the way down. Excellent. And then we'll go into pronation, supination. So if my patient will keep their arm at about 90 degrees by their side and go from supination into pronation and then back into supination. Perfect. And that's about all for range of motion for the elbow and forearm. Next, I'll go into special tests. So my first special test I'm going to do is going to be valgus varus, testing for the UCL ligaments, which are also a part of palpations that I did miss. So you're going to have your UCL ligament right on the medial aspect, so I can have my patient kind of bend their elbow to about 50 degrees or so, and you'll just feel a band right along the medial aspect. And then same on the lateral aspect of the forearm. Right around here you have your RCL. So the varus stress test is going to stress the UCL or the RCL ligament. And so I'm just going to apply a varus force, so from the medial side to the outward side, stressing that ligament to test for any laxity or excess movement. So I'll have my patient extend their arm all the way, and I will just apply that force from this side, stressing that RCL ligament. And then I can also do it at about 20 degrees of flexion as well. And so I'll just come over here and apply a force just like that. Next, I can go from the lateral side to test the UCL ligament. And so I can have my patient stay in about 20 degrees of flexion. I'll go ahead and do that one. And then just testing that UCL ligament there for any laxity. And then also fully extended. Coming out, as you can see, my patient can hyperextend the elbow, so I'll have him bring it up a little bit and then test it that way. Next, I'm going to do a medial epicondylitis test, just testing for any pain along the medial epicondyle, which is where all your wrist flexors are going to attach. So I'll just gently apply pressure to the medial epicondyle, and then I will have my patient resist wrist flexion. So go ahead and resist me. All right, and if there's any pain with that, then that would be a positive test for medial epicondylitis. Then next, I can do the same thing with the lateral epicondyle. So I will just apply pressure to the lateral epicondyle right along here, and those are where the wrist extensors are going to attach. So then I'll have my patient resist wrist extension. Go ahead and resist me. Perfect. The next one I will be doing is a hook test for the biceps tendon, just to make sure that's still intact if you're kind of wondering if they have a biceps tendon rupture or anything, just to test that. So I have my patient in about 90 degrees of shoulder abduction, and then I'll have them flex their elbow a little bit, and I'll just grab up under that bicep tendon that's right there, and you can feel the tight band as it's still intact, and if it's not, it will be very noticeable and you won't be able to hook underneath it. Then the last test we'll do is the posterolateral rotary instability test, and that's just testing for any chronic instability in the elbow. So I have my patient lay up on the table, and we're going to be doing a lot of things all at once. So I'll have my patient in about 90 degrees of shoulder flexion and elbow flexion, and my patient will also be in pronation, in supination, And what I will do is I will apply an axial load from the wrist into the elbow as I'm applying a valgus stress to the elbow. And while I'm doing both of those movements, I'll pull the patient into extension, elbow extension, and turning their forearm into supination, into pronation, my bad. So I'll apply the pressure, valgus force, and moving them. And then it'll go back. And that is, again, testing just for any instability in the elbow. This is one that you may need to be very cautious when doing, just because their elbow could dislocate or pop out. And that is all.